talk about diabetes. Talk about how diabetes could affect the eye, especially the retina, but any part of the eye.
So what happens in diabetes is that we think about elevated blood glucose, and that elevated blood glucose can damage the very small cells that make up those tiny blood vessels. This can cause those blood vessels to break down and become leaky. Now, what those blood vessels leak is kind of a protein-like fluid. There can be fluid that leaks out of the blood vessels, as well as lipid that leaks out of the blood vessels. This can cause swelling or edema inside the eye. And when it affects the central part of the retina, we call this macular edema, which can be seen in diabetic retinopathy. The other thing that happens to the tissue inside the eye with diabetes is that those very fine, small blood vessels become stressed for oxygen. This creates what we call an ischemic type of condition. Now, when blood vessels don't get the amount of oxygen that they need to supply the retina with oxygen so that it can function to allow us to see, what happens is that the body increases the production of specific growth factors that cause the development of new blood vessels to grow. Now, the challenge with this is that those new blood vessels that grow are not a good quality type of blood vessel. They leak, they're overall fairly sick new vessels. So they don't function overly well in providing new oxygen. They really cause more trouble to the inside of the eye than help, certainly. And when this happens, this new blood vessel formation happens in diabetes, we call this proliferative diabetic retinopathy. There is proliferation of new red blood vessels. Now, what happens with those blood vessels is that they leak, they cause swelling in the eye, and in very late stages, they can pull on the inside of the retina, causing traction, and a specific type of retinal detachment can happen, which is something that certainly does require treatment and that patients often do lose vision from, even with appropriate treatment.
How important is it for a patient who has diabetes to get their eyes examined based on everything you've just said?
The recommendation from the American Diabetes Association, the American Academy of Optometry, the American Academy of Ophthalmology, the American Optometric Association, really all of our national governing bodies that look out for the public as far as managing systemic disease and ocular complications of systemic disease agree very well on this, that for anyone diagnosed with diabetes type 2, the recommendation is to have an eye exam at the time of diagnosis. The reason why is that many people who are newly diagnosed with diabetes type 2 already have subtle changes inside the eye related to diabetic retinopathy that may or may not require treatment. Now, even if you're one of the lucky people who has diabetes type 2 without changes inside the eye, the recommendation is still an eye exam through a dilated pupil every single year. Now, depending on the amount or the level of diabetic retinopathy that you may have, that recommendation for dilated fundus exam can be less than once a year.
Now let's talk about the lens of the eye and how could diabetes affect the lens?
So it can cause clouding of the lens like a cataract formation, but also what can happen with elevated glucose levels, there can be an increase in what follows that elevated glucose. So water or a fluid can be absorbed at a higher rate by the lens. That causes swelling of the lens. Now, sometimes what people will notice and what can bring them in for their first eye exam are changes to their vision. One of the things we often ask about is their blood glucose. So with fluctuations, increases and decreases to blood glucose, that can cause changes in the swelling of the lens. Now, because light needs to pass through the lens to focus on the retina to allow us to see clearly, when you're changing the overall area and thickness of that lens that happens with swelling, patients can note blurred vision, they can have changes to their glasses prescription, and that's one of the signs that we think about and one of the questions that we often ask patients who have or report this fluctuation in vision. We ask them about their blood glucose and their management with their physician.